for MSN field experience opportunities. I am Dina Berggren, one of the Career Services Advisors at Walden. For those of you who are not familiar with the Walden Career Services Center, our mission is based on preparing our learners to navigate career transitions through educating, coaching, and advising. Here is our career services team. My picture is on the left, followed by my colleagues, Nicole Skalski, Denise Pranke, and Andrea Obricki. And our Senior Director of Career Services is Lisa Cook. She will help us field questions here today on this program. Also joining us here today is Claire Keller. She is the Nursing Field Education Coordinator Supervisor in the School of Nursing. Ms. Keller is responsible for the day-to-day operations of the Field Education Coordinator Office. She practiced as an oncology nurse and clinical specialist for many years and is a certified pediatric nurse practitioner. Ms. Keller also taught clinical practica for 5 years at a community college and is a member of the Sigma Theta Tau National Society. And with that intro, I'd like to hand it over to you, Ms. Keller, to continue the program and discuss our objectives.
Great. Thanks so much, Dina. So I will start with a little bit going into the agenda. One of the things we're going to do today is define the purpose of the practicum experience. Something that you need to know is what is the ultimate goal of your practicum. You will need to be able to tell a prospective preceptor what it is that you need specifically. We'll also talk about some strategies for a proactive search. We'll go into that in a little more detail later. You're going to need to learn to market yourself. This is important because prospective preceptors may not know you or Walden, and you can provide the information that can overcome the barrier that happens sometimes with it's an online school. So that's really important as well. And you need to have a plan. You shouldn't be out there randomly just hunting for a spot. You should have an actual plan. And if you do, I think that you typically would be more successful. So what is the purpose of your practicum experience? Regardless of the specialization that you're in, if you're in any of the MSN specializations, you're going to be doing a practicum in order to fulfill your program requirements so that you can graduate. So if nothing else, that should motivate you. A practicum is also one of the best ways to learn skills that can make you successful when you do graduate, because you'll be able to demonstrate that you were actually doing hands-on care as an NP student, or actively involved in an informatics project with someone else who's has that as a specialization. And that hands-on experience gives you an advantage when it comes hiring time, because you can demonstrate that you've done that and you just didn't take a class. Certification. For some of the specialties, this program leads to certification. That's the informatics has a certification. All of the NP specialties have a certification, and this practicum is crucial to prepare you for that certification. The things that you learn when you're doing your practicum are different often than what you learn in the course, and actually reinforce what you learned in the course and make it a little bit easier, I think, to get through those exams. And again, mostly for the NP students, you have taken assessment courses, but now you're actually going to be doing that and doing your diagnostics on people. And that is going to hone your skills, and you will have a nice base of experience based on that when you go out looking for that job. So now Dina is going to help us get a little bit of feedback from you, the audience.
Okay, so what are some ways to identify a potential preceptor and practicum site? If you can type in your ideas into the question box, and we can read some of these ideas. We'd like to get your feedback regarding what has worked for you or what strategies have you tried to identify preceptors and practicum sites. So I will look to see what questions are coming in through the system. Okay, so Stephanie says current employer. Reaching out to your current employer to see if there are opportunities to complete those requirements. Physician NP practice that you are familiar with already. Okay, so from working in nursing, those physician or NP practices that you already know about, what other ways are there to identify a potential preceptor and site? Okay, Teresa says, where other NP students have gone before. So taking a look what other students have done in the past. That's a great way to identify potential sites. Karen says, working with a liaison at the hospital to associated practices. Excellent. And let's see if we have any more feedback. What do others think? What are some ways to identify potential sites and preceptors? Okay, so we received some feedback here. Thank you for those of you who participated. Just a few ideas for all of you. Visit websites of hospitals and clinics and take a look at their history and mission, client population, job titles of individuals who work there, maybe looking to identify potential preceptors and some of the challenges that those hospitals or clinics may have. Reach out to professional associations. Look at member directories and information through professional associations such as the American Nursing Association, American Nursing Informatics Association, and of course there are many others out there. And really tap into your network of family, friends, former coworkers or current coworkers, alma mater, Walden students, and others. And finally, take a look at social media sites, visit LinkedIn groups, do a people search to find out information on potential preceptors and their credentials. So all of these ways are really great ways to expand your search. Okay, and with that input, next Ms. Keller will share her insights into site requirements.
Thanks so much. Thanks so much, Dina. I also wanted to just tag on a couple of other ideas of where to look if you hadn't thought about. There is Angie's List actually has a healthcare component now, and that helps you. I've often found practices that I didn't even know about in my own area. Tailor your Google search very specifically to what you're looking for. Type in the name of a town nearby and primary care or whatever it is that you're trying to look for, and you might find that you get different results. Also, people tend to look in areas that they're familiar with. Try looking in the opposite direction. One of my little things is to get a map, put a dot where you live, draw a circle around it, the distance you're willing to drive to a practicum, and then look in the opposite direction that you typically would go in. So those are just a couple other additional things. But we'll get into knowing your targets, the preceptor and the practicum site for the nurse practitioner students. We'll get a little more specific about that. Your search is going to be more successful and less frustrating if you know exactly what you need for each practicum course. It will also decrease the risk that your practicum application will be denied when you submit it. So it's very important to know exactly what you need to do for each practicum course. So briefly, I'll just go over those courses and some of the requirements. One of them is, the first one that both the FNP and the AGNP take is 6531, which is primary care of adults across the lifespan. Please note across the lifespan. That means 20-somethings on up. That means you need a wide range of ages in the adult population, not just geriatrics. The other thing that is do you know what primary care is? Primary care, I can tell you more easily what it is not. It is not acute care. It is not cardiology, neurology, pain management, hospice, oncology, just to name a few. Primary care really means that the care that's provided for the patients is typically clinic-based. It is wellness care, those annual physicals and illness care, and it focuses on really the entire patient. It's not a specialty care. It's not acute care in the hospital. So think of where you get your routine health care, and I'm imagining that it would possibly be in a family practice or a primary care clinic, and not likely in a specialty area. That's where oftentimes these practicums get denied because of that issue. So think again, broad, across the lifespan. For the FNPs, when they take primary care of adolescents and children, we're talking pediatrics. We're talking primary care of pediatrics. The same definition. This is not a specialization. This is routine health care for children. Where do they go to get their child checks, their vaccinations, and their illness care? So this would not be oncology or cardiology. Again, I can't emphasize enough how many things are turned down because they have a specialty care. And again, primary care of children means children of all ages, infants through teenagers. Some places only take care of children age 5 and up. That's not okay. We've got to get those infants in there too. Primary care of women, again, this is across the ages. We don't want you to just be, if you're going to do healthcare of women with geriatric patients, you're not going to get a good picture of care of women across the lifespan. So this is essentially the OBGYN, the routine GYN care, all ages of women again, pap smears, breast exams, birth control, etc. Excuse me. It also includes obstetrics. This means that you need to take care of healthy pregnant women during their pregnancy as part of this practicum. Without that component, your practicum will not be accepted. You need to do 44 hours of normal OB and 100 hours of GYN. The only exception is in the adult geriatric nurse practitioner specialization, they are not required to do an OB component, but the family nurse practitioner students are. So keep that in mind. And then the direct care roles, I love the name of this because it goes on and on. Direct care roles in health promotion and disease prevention across the lifespan. What this amounts to is really, this is the course that brings everything together that you've done up to this point. The best sites for this would be family practice and primary care. You need to see all ages again if possible. And health promotion, things like weight loss, smoking cessation, exercise, and then disease prevention, cholesterol screening, BP screening. So the focus is a little different, but again, you're bringing everything together with that last practicum course, and everything you've learned all along you're pulling together. One of the courses that is different for the adult GERO students is 6540. In place of the pediatrics, you'll be doing primary care of frail elders. This gives you a little more flexibility in sites because you can actually choose a long-term care facility, a nursing home, places where you'll find frail elders. So oftentimes there are actually clinics that specialize in that as well. So there's a little more flexibility there. But it's important to know this so that when you go and are looking for a preceptor, you know exactly what to tell them when they ask you what you need. Okay, I'm going to change gears just a little bit here and talk about the other specialties that we have in the MSN program. Education, leadership and management, and informatics. All right, so what do we need to know specifically about those specialties so that you can have a successful practicum experience? I'm going to talk really just about the quarter-based, just so you're aware, because there are some, that's becoming, taking over, sort of the semester-based is eventually going away, and the quarter-based is there's some really important differences in that. So let's talk about preceptor and site requirements for the quarter-based MSN specialties. So education, there are 2 practicum courses. It's very important to note that 6341 is a clinical course. This means you will be interacting with patients. While you may not be providing direct care, you will be involved with patient care and you will be seeing patients at the bedside or the clinic. So it's very important to know the purpose of this practicum is to advance your knowledge in a specialty area, your clinical knowledge. So, for instance, if you are an oncology nurse and you want to learn more about a specific type of oncology, then maybe you could do your practicum with a clinical nurse specialist on a hematology floor. Or if you're particularly interested in gastrointestinal patients, or you know, pretty much whatever is your thing or is your interest, that specific clinical area should be what you're focusing on. And for these sites, we're talking preceptors that are clinical nurse specialists, nursing education, even nurse practitioners. These types of sites you would find would be hospitals, inpatient acute care, clinics, nursing homes. It is not appropriate to choose faculty at your local community college because this, again, has a clinical focus, and your faculty, other educators in your universities are not going to be able to provide you with that experience. Even those faculty who mentor students in your hospital during their clinical experiences are not going to be appropriate to select for your clinical experience. So be sure to know exactly what the requirements are for each practicum. For leadership and management, it's important to know that your preceptor must be working in management. While many nurses are leaders, not all leaders are in management. So please note that that they must have responsibility for budgets and staff and that sort of thing, because that's what the focus of this degree is. Also important to know is that while we want you to be working with a preceptor who has an advanced degree in nursing, oftentimes nurses would have gone on and obtained an MBA or a master's in healthcare administration. As long as they're nurses, that advanced degree is acceptable in place of the MSN or the MN degree. For informatics, it's often very hard to find an informaticist that's got a master's in nursing. Just know that one of the issues is we want you to get experience with an expert in the field. And like I said, oftentimes it's very difficult. It's a relatively new specialty. So find that expert in the field that you want to work with. And then you can go and find a co-preceptor who is an advanced practice nurse. And with that combination, you'll get the experience you need in informatics from an expert, and you'll also see how the advanced practice role is for nurses, and they will be able to mentor you with that aspect of the course. So there is some flexibility in how we do this, and the most important thing is to make sure that you know what you're looking for when you're setting out, and that if you have any questions at all about what's appropriate, that you contact the field office, and we can help you understand that. And then I believe we're going to move on to Dina discussing ways to market yourself to your potential sites.
Okay, thank you, Ms. Keller. In the next part of this program, we will focus on ways to market yourself to increase your chances of landing a potential site. Consider, as you approach marketing yourself, what you are best known for, how others perceive you as your strengths, and how can you add value to others. In other words, share what is unique about you and your nursing experience. Your interests, clinical skills, personality, values. Focus on your academic achievements that set you apart from other nursing students, work experience that you've gained, professional contributions, including presentations you may have delivered or leadership roles that you've held, any volunteer experience in your community or community involvement, and also any other specialized knowledge in your field or your certification. So in other words, think of ways that you can stand out from others and make potential sites and preceptors interested in you. As part of your practicum search, you will also need to market Walden University and your program. Here are a few key points to share with potential sites. Walden is a regionally accredited institution, and the MSN programs are also CCNE accredited. You want to mention the accreditation. Walden also has a very strong social change mission that sets it apart from other universities. We have qualified faculty with degrees from leading universities all over the country and all over the world. There's a diverse global perspective and community at Walden. National and international student population where your classmates bring broad global perspectives to the classroom. And of course, the rigorous curriculum. Consider these talking points and share them with potential preceptors and sites. And next, Ms. Keller will discuss the importance of fit as you approach potential sites.
Thanks, Dina. Fit, it's very important. Will you fit in with the people and culture? Do you feel comfortable when you visit the site or talk with your potential preceptor either in person or over the phone? If you don't, then you may find that your experience might not be as positive or as useful as it could be if there's a feeling of discomfort. So keep that in mind. The other thing is you need to know that the site meets your requirements. Someone may have told you this is a great site, but make sure it meets the requirements that I discussed earlier before you latch onto them so you don't find yourself without a site later on. The other thing that's important is the credentials that your preceptor holds. Are they the right qualifications for the course? Are they qualified to mentor you? Make sure that you look into that, hopefully before you even get out there and talk to them. Doing a little research into the practice or site can often be very helpful. You can often find information about people Googling them, or you can even go to LinkedIn and often find that. The other thing that I think is really important, and we've discovered it almost, unfortunately, after the fact, is that working with a preceptor for the length of time that you do, you're going to have a very close and relationship with them, and you want to make sure that you're comfortable and they're comfortable. We have had some NP students who have had a preceptor take them sort of begrudgingly because a friend said, could you help us out? And often those have not ended well. Someone who feels obligated and is not really invested in helping you with your education may not be willing to do what needs to be done, or may actually change their mind and drop out while you're in the middle of the course, and you don't want that to happen. So also, if it feels, like I said before, if it feels like an uncomfortable situation, move on, because again, it's so important that you get all the experience you can out of this opportunity, and a difficult environment will will make it very difficult for you to learn and I think much more frustrating. So I think from there we're going to talk about how to create your application materials.
So the question is, why take the time to create a practicum portfolio versus simply sending in a resume? And there are many reasons to create your portfolio and take the time to do this. A portfolio sets you apart from other applicants. So while others are simply sending in their resumes, you are sharing actual samples of your academic work, your professional work, and your achievements through your portfolio. A portfolio leaves a lasting impression because it shows that you've taken time and you've made an extra effort to create these materials. And a portfolio also allows the site to learn more about you. So for instance, if you bring your portfolio to an interview, you can then refer to specific samples and leave your portfolio for them to continue reviewing even after you left. And all of these reasons make it very important to take the time to create your materials and your portfolio. So Ms. Keller, what types of documents should students include in a portfolio specific for the practicum search?
Well, there are actually a number of things. The first thing would be a cover letter. That cover letter should be very specific for the practicum course that you are seeking a preceptor insight for, which is a backward sentence. You can get the course description out of the catalog. Include that. Write some objectives. You don't need to necessarily have the course objectives. What are your objectives for that practicum? What do you want to have? What do you want to know at the end of your practicum? Include that. The other thing is the dates that you are requesting. You need to know what the dates are when the quarter starts and the quarter ends, and the number of hours that you'll be required to do during that time. It needs to be in your cover letter. Many students will go and say, I don't know when it starts, it's in the fall. That does a couple of things. First of all, it makes you look unprepared and not really on top of things. And then it means that you'll have to contact somebody to find out what the hours are and the dates are, and you'll have to go back. And that does not really leave a very good positive impression. Know this information in advance. You can always contact the field office and we can help you with the dates. There should be your contact information should be on the letter, and as should the contact information for the field office. For the nurse practitioner students, I encourage them to put my contact information, because there are often questions that need sort of that attention. I also think it's important to have your resume. Make sure your resume is up to date and that it reflects your experiences that will be particularly helpful to the site, knowing that you have some clinical experience. If you're in one of the informatics or leadership and management, what kinds of things are you interested in? You have to do a project. What do you want to know? Do you want to look at how new nurses are mentored when they're hired into the units? What do you want to do? If you have an idea of that, and if it's something that could also ultimately be of benefit to your preceptor and their site, they are going to be much more likely to consider working with you. Again, letters of recommendation are very helpful. Oftentimes when you're looking and the sites don't know you, you don't really know them, and why should you walk in the door and why should they accept you as a student? Give them all the information they need to know to accept you and to be enthusiastic about mentoring you. So get a couple letters of recommendation from a manager, from a physician that you work with in the hospital, on the floor, in your regular job. Even any of that sort of thing does really speak loudly about your being a great person to take on and to mentor. So I think from there we're going to go to Dina talking about some tools that are available to help you build that portfolio.
Okay, so Career Services offers an OptimalResume system to help create an online portfolio that you can share with potential preceptors and other professionals. You are able to access OptimalResume via the Career Services Center website or go directly there through the link waldenu.optimalresume.com. You can also print out your portfolio documents, organize them in a professional-looking binder, and bring your tactile portfolio with you to the interview. That way you can show potential preceptors examples of your work and achievements and leave a lasting impression. And next, let's take a look at two very important components of our portfolio, the cover letter and the resume. Provided here is a sample cover letter for nursing practicum. Your cover letter should be written using a standard business letter format, include 3 to 5 paragraphs of information, and be limited to 1 page in length. At a minimum, your contact information should include your name, mailing address, phone number, and email address. You may also want to include a link to your LinkedIn profile and or a link to your online career portfolio. In your introductory paragraph, you want to introduce yourself and your program and mention that your program is CCNE accredited. Mention your preparation for the practicum experience, including specific coursework that you completed to prepare for this opportunity. And let the site know how you heard about it, the opportunity, especially if someone referred you to the site. Briefly describe why you're interested in that particular site. So in this case, our applicant, Linda, has researched the clinic and knows they have a reputation of providing high-quality medical care. She mentions this in her introductory paragraph. Your second and third paragraphs should provide a brief summary of your experience in nursing. This should include your years of nursing experience, nursing positions you've held, your specialty areas, and any professional achievements or accomplishments that can help you stand out as an intern. Showcase your academic program. What are your knowledge areas? How will you apply them as a nurse practitioner intern? Emphasize the quality of Walden's faculty, the social change mission, and also specific skills you've gained as a graduate student. If you are engaged in activities outside of your work role related to health sciences, such as volunteering in your community or active involvement in a professional association or maybe other professional development activities, mention those as well. And finally, your last paragraph should provide the nurse field experience coordinator supervisor's contact information, and that way the site has a contact person in case they have more questions about the program, and they can contact Ms. Keller directly, and she'll be happy to provide them the information they need. And conclude with a general statement expressing interest in a future discussion. Following this type of format and utilizing these tips can help you create a targeted, well-written letter that conveys your unique value as an applicant. Make sure to tailor this letter so it captures your specific experience, skills, and strengths. Now, the second document to include in your portfolio is your resume. Listed here are a few common resume sections you may want to incorporate in your document. These are contact information with your name, mailing address, phone number, and professional email address. A summary of qualifications that highlights your greatest strengths and achievements. An education section listing your degrees, licensures and certifications related to nursing, work experience in the nursing field and beyond, affiliations through professional associations, any presentations you've delivered or papers you've written, volunteer experience or community involvement can be included, and other sections that can highlight additional professional activities, honors or awards you've received, and any other relevant skills related to the nursing field. So how would you like to view some sample resumes to help you create or strengthen these sections? To do this, you can visit the Optimal Resume system. So let's take a closer look at Optimal Resume. Optimal Resume provides resume samples by categories, such as field experience, healthcare practitioners, and education and training. The field experience section includes a resume sample specifically developed for the MSN Practicum search. Remember that Optimal Resume samples are there to help you create professional documents to share with potential preceptors and sites. Now that you have your materials ready, what other strategies can help increase your chances of success? You want to tell everyone you know you are searching, because you never know. Maybe a family member, a friend, coworker, or someone in your community will have a tip for you. Join special interest groups related to your field, which can include professional associations such as the American Nurses Association, and LinkedIn groups such as Nursing Network, the RN Network, Nursing Careers, Nursing Professionals, and there are many other LinkedIn groups and forums out there. Ask experts for advice and expand your search. So use phone directories to locate clinics and facilities in your area and increase the number of organizations that you are targeting. And Ms. Keller, what other tips would you suggest? Are there any other tips to help students expand their search?
Absolutely. There's always more options. Some of the things that have actually been successful: talk to your own primary care physician. Not that I don't really believe it's appropriate for you to do your practicum there, though a few people have. But talk to them. Who else do they know? Would they be willing to recommend you to somebody, a colleague at a different practice? You know, if you have children and they're going to a pediatrician, talk to your pediatrician and say, hey, you know, do you know anybody that might be interested? Getting that kind of recommendation can really make a huge difference in finding a site. Really try to think outside of your box. If you've been a hospital-based nurse, you've got to think outside of the hospital. If you work for a large system, they probably have associated clinics. Go to the website and go to where it says Find a Doctor, and click on that and type in family medicine, primary care, OBGYN, whatever it is you're looking for, and see if they have those specialties in your facility. And you can do that with any of sort of the regional or larger systems in your area, and you might just find that there's a lot of more places to look than you were aware of. Even your local Veterans Administration hospitals, they often have outreach clinics. They'll have clinics associated with the hospital, but they might have outreach clinics, you know, 40 or 50 miles away in several different locations for the convenience of the veterans. Check those things out. If you haven't heard of HRSA, the Health Resources Service Administration, your government at work, that can be a helpful site. Go to the HRSA site, and it's HRSA, and you will see that they have Find a Health Center. There are things called federally qualified health centers. They are funded by the federal government, but they are managed and run locally. Each site would be independent, and you would have to facilitate an agreement with them. But those are clinics that serve underserved and low socioeconomic patients, they often have all of the types of clinics that you need for your NP classes. They'll have primary care, they'll have pediatrics, they'll do women's care. And when you click on the Find a Health Center, a box will pop up that says put in your county and state. Plug that in, and a list should come up. If you don't get a list for your county, look at the county next to yours. There are usually quite a few, especially in the more populated counties. But those are all ideas that you can use to think outside of that box and hopefully find something that will meet the needs of you and your practicum requirements.
These are excellent tips. Thank you for sharing those, Ms. Keller. I also just want to mention to work on your professional image and really assume the brand of your future role. So as you are approaching preceptors and those sites, you want to bring your best foot forward and make a positive first impression. And then partner up with other students or professionals and practice your site search skills and your interview skills. It's very important to be able to convey how you stand out from others and be able to share all of your accomplishments, achievements, and experiences that can also benefit that potential site. Tap into social media to get more information, advice, and resources from the Walden community and beyond the Walden community. Here is a LinkedIn group I came across for nurse practitioner preceptors. And you can see here that this post is specific for Walden NP students. So LinkedIn groups can really help you connect with others, share important information, and pay it forward and help others in their search. So be creative in your search and help others with their journey. Reach out to the field education office if you do find a need for additional consultation. They are there to assist you and provide tips and strategies and information. And for additional career-related information, visit the Career Services Center website. And we have a comprehensive resumes and CVs tab with detailed information on creating strong application materials. You can schedule a career advising appointment via My Walden portal. You can access our OptimalResume system and also view archived webinars. We have webinar recordings on over 60 career-related topics, and some of these include using OptimalResume's Resume Builder, Letter Builder, and Portfolio Builder functions. You can watch program-specific webinars on the nursing field experience process and explore other related topics such as crafting effective resumes, using LinkedIn to build your professional network, midlife job search, and many others. Get connected with us by joining the Career Services LinkedIn group, following us on Twitter, reading student success stories on our blog, and registering on the OptimalResume system. And you can access everything from our Career Services Center website and email us if you so choose as well. And with that, let's go ahead and open it up for some questions. So Lisa, do we have any questions that have come in from students that we can address?
Yes, Dina, we do. Teresa asks, can we precept at a hospital under a PA? Can you hear that?
Keller, I think that one's for you.
That was for me. If as a nurse practitioner student, yes, you may work with a PA. You can work with a PA, an MD, a DO, or a nurse practitioner. Hospitals are out. It has to be a clinic-based outpatient facility. Inpatient acute care is not acceptable for any of the practicums.
Okay, and then another question is, Beatrice poses the question, do students have to identify sites and preceptors on their own? In my experience, we find the facility for the students and teachers from the college to accompany them. Is it common for students to identify their own preceptors and facilities?
Can you repeat the last part of that, Lisa, for me?
Is it common for students to identify their own
Okay.
Preceptors and facilities?
That really varies according to the educational facility, the institution. At Walden, we do require students find their own sites. We can provide some help, some direction. We do have some lists of sites that have been used by prior students that can be helpful, but we are not able to really help you find that site. We can help you secure that site. Once you find it, we'll talk to a site if they want questions, but you really are responsible for getting out there and finding those potential sites. Some of the bricks and mortar type schools have already put all that in place and they just place students. But the other issue there is that they have a finite area of geography where we have students all across the country. So it is required in our program that you find your own site.
Okay, terrific. Thank you. And then Marcia poses the question, do you need to set up your practicum at the beginning of your studies? If so, how would you find out the specific dates to tell your potential preceptors?
The earlier that you set up your practicums, the better. You'll find that there are areas of the country where there are other schools, and sometimes those schools secure their sites up to a year in advance. I think at a minimum you want to be starting to look for your first site 6 months prior to when you expect to do the practicum, but the earlier the better. As for information about the dates, you can always contact us. You can send an email to NP Field Training and ask what are the dates for fall quarter of 2015, and we will find out and send them to you. So anything we can do to assist like that, we're happy to help.
Great. It looks like that's it for the questions, Dina and Claire. Thank you.
Great.
Okay, great. I'll go ahead and we'll wrap it up for today here. And we have included these additional resources to help you with all aspects of your search. These include 360 Reach, which is a free assessment that allows you to receive feedback on how others perceive you. The ENP network, which provides a helpful directory of nursing practicum preceptors. The nursing directory, which includes lists of nursing job banks, professional associations, blogs, forums, and specialty areas. Quintessential Careers is a great site that has multiple tutorials on career research, interviewing, and other career-related skills. And finally, Interview Magic, that provides tips and strategies to help you prepare for interviews. So hopefully those will be helpful for you as you approach your practicum search. And with that, I'd like to conclude today's program. I want to thank all of you for joining us here today. And I want to especially thank you, Claire Keller, for your insights, tips, and advice related to the practicum search process. We look forward to helping you reach your goals.